Hi guys, you have seen my face for the first time. This is Safaya Adeze. On this program, I talk about um, health and well-being, politics of great concern, and weekly declaration. Today, we'll be addressing issue about important tests to do. Yeah, important tests that you should do to save your problem in the future. Five tests. These tests help you. They are detective. There are tests to help you detect diseases such as diabetes. Sometimes people come to the hospital for a different reason, and when you do a blood test, you find out that they are diabetic. And even when you ask them, "Are you diabetic?" they say no, they are not diabetic. But when you do a test for them, you find out that they are diabetic. And most of these diseases don't give sign. And by the time it start giving you symptoms, it's already too late. So first test on the list is full blood count, FBC. Very effective. This test will help you count your red cells, white cells, platelets. You need to understand that your blood is full of blood cells of different type, and they take oxygen from your lungs to your blood and carbon dioxide back to your lungs so you can breathe. So your white blood cells, they are the soldiers of your body, protecting you from infection and other diseases. Platelet, you see, when you have a wound, platelet is the one that help to heal the scar when you're bleeding. So this full blood count measure all these things. It tells you when each of them is too low. Like when your red blood cell is too low, it's signs of anemia. That you feel tired, you feel weak, you doze off sleep, anemic. That is it. So sometimes when your platelet is also high, you see that is maybe because you see bruises on your body, people bleed anyhow. That's the thing. And when your white blood cell is very high, that means your body is fighting a particular infection. So you need to know all these things and know what is happening in your body. Another one is blood sugar. You need to check what is your sugar level. If it's within, there's what we call B1C. That helps to measure your average sugar over 3 months. That is the more accurate ones. It's more accurate than the BM check we do in hospital that they do daily. So the BO1C help to detect if you have diabetes, because sometimes your random blood sugar, you can do it and it will be low, but the HO1C will give you the accurate text for the past 3 months. And if you don't manage blood sugar properly, it will damage the tiny blood vessels in your body, affecting your eyes, your kidney, and other things. you know Diabetes is very dangerous. So when you notice all these things, your eyes, you feeling blurriness of your eyes, report it, especially when you're more than 35 years and above. So if you notice that you're gaining some kind of weight, or your diabetes or your family, don't relent. Check, keep checking. People will say, God forbid, you need to check. Another one is lipid profile. That help to check the fat in your blood, the bad and good cholesterol. When your LDL is high, the bad cholesterol, it start gumming the inside of your blood vessel, like as if there's a blocked pipe or artery. As you grow older, some of these artery get slimmer. That means you're having less blood flowing through it. One day there might be clot formation, or there will be constriction, and that is how heart attack comes in. Or if it goes to your brain, it causes stroke. So the good cholesterol is the HDL. It's like the cleaner. It cleans your body. It removes the bad cholesterol from the body to the liver, so that the liver will clean it up. So if you have high LDL, it's a good sign. If you have low, it's not a good sign. Things like triglycerides, a kind of fat that is inside your fat. When you eat too much sugar, white bread, cake, drinking all those kind of things that are, so it will increase your triglycerides in your blood. And high LDL with low LDL It's a very bad combination. So all these things you can easily know when you are doing all these tests. Lipid profile is very important. Okay, okay, it's very important. Another one is kidney function test. You know, your kidney, they have a way of compensation. They keep working. They have a way of excreting waste and other things, but trying to maintain the blood pressure and all those. You know, they keep working. But when things start affecting the kidney, you may not know because it doesn't show, the symptoms doesn't show on time. Before you start having symptoms, a lot of damage have been done. 80 to 90% have been damaged, have been done already. You see the patient now battling with their life. So by the time people find out, the only option will become dialysis or kidney transplant. Dialysis is expensive. Even some people had dialysis, they did not recover from it, especially in the Western world, you know. So these things is very dangerous. When you take, and again, taking pain medication irrationally, you know, it destroys the kidney. You see people, any little thing, they take pain medication, ibuprofen, paracetamol, those things. Then again, liver function test is very important, where it can detect you hepatitis and other things. Liver is one of the organ that doesn't complain quickly. It keep working and working even when it is being stressed. So liver keep working. Even albumin, the main protein that help you to transplant and this to other, liver is the one making it. Bile that break down fat is liver. Immune protein that help fight infection is liver. You know, cholesterol is liver. So liver has a lot to do. Check how this is working. Look after the, check how is this organ is working. Is it in good condition? Does it need care? Is there anything happening? You need to check. Don't wait until the liver complain. The liver has an enduring nature. Even when it's weak, it keep working. It can even be working without you knowing that it's already sick. The only way you will know is by checkup. Another thing that destroys liver is hepatitis B. It's a virus that quietly destroys the liver. A lot of people have hepatitis B without knowing it. So when you go to check, even I see some people when they get a new job, they say, go and check hepatitis B. They'll say, no. Go and check. Nothing wrong in you going for a test. Test yourself. You know? So it's very important. Hepatitis B spread by body fluid, unprotected sex, blood transfusion, mother to baby. Those are the ways it can be spread. But hepatitis B has vaccine. It can protect you for life. And those having it, early treatment will bring that virus down. Okay? So, please, there's no way you can treat yourself without checking. You cannot fight enemy you did not see. When you check yourself and know anything going on, you now know the treatment to take quickly. There are a lot of outlets, even in the Africa and Western world, there's some NGOs that are helping people with free hepatitis B check and treatment. A lot of NGOs, like in Africa, like in Nigeria, there's one they call the Aproko Doctor. He has a center where he's supporting people. Okay? In Nigeria, if you're in Nigeria, look for Aproko Doctor Foundation. He's helping people with the hepatitis B screening and treatment. Yes, those are kind of people we want in Western world. People that can support. So if you also have the means to support him, please, you can partner with him. Yes, there's nothing wrong. Partner with him. Partner with Aproko Doctor and let this spread. Let it spread even across Nigeria to other African countries. So please, look after yourself. All right? Download their doc or click. There's a link that he shares for this. He will help you run the test freely if you are in Nigeria. I don't know of other African country. So please share this video, all right? You might be saving a life, you'll be saving a soul. You can also be saving yourself, okay? Nothing wrong is checking yourself. Check out yourself, not just out on a date, going to a restaurant to eat, going to that is. Please share this video, click like, so that whenever I share another video, you'll be the first to get it. Save a life, because you can't give your life.